Before hair transplant, we ask patients to stop some products or medications. Those are usually the ones that are blood thinners or causing more bleeding. Could be over the counter like fish oil, omega-3, or could be like prescription, aspirin, coumadin, warfarin. A lot of those medications could cause more bleeding during the procedure and make this procedure even longer than what it is. So we ask patients to stop them. If it's over the counter, it's not prescription, patients can stop it 2 weeks before procedure on their own. If they are prescription medications, we want you to check with your physician and see if it's okay to stop them, or maybe sometimes they have to replace them with something else. Some of those medications are risky to stop based on your physician if that's what they decide. But either way, if we stop them, we want to see how soon after procedure we can resume them. Usually the first day after procedure is good enough. 1 day is plenty to wait until you're resuming them. But if you are on those medications that you have to resume them as soon as possible, we can say even the night of procedure you can resume them. I hope you learned from this video. If you have other questions, don't forget to put them in the comment section, and please follow our social media if you have other questions or you want to learn about the newest in hair restoration technology.